It takes a village as part of the New York State Office for the Prevention of Domestic Violence's Spring Domestic Violence Regional Councils. Participants are proving that is the case when it comes to responding to and preventing domestic violence.
We've had small group discussions where we're mixing people up, different counties, different systems, and they're talking amongst themselves and talking about it from a survivor's perspective.
The regional councils were first introduced in the New York State 2020 proposed budget. Now OPDV goes on the road, visiting each of New York's 10 regions twice a year. This time around, the focus is coordinated community response. April Moss is the Director of Policy, Innovation, and Professional Education for OPDV. She says the theme came from OPDV-sponsored survivor listening sessions. During the sessions, one thing survivors noted over and over was the need for agencies to work more closely together.
Because it's very, very important that we're looking at this through a survivor-centered lens, a trauma-informed lens, and a culturally responsive lens.
This is the Capital Region DVRC held in June. In the room, local law enforcement agencies, service providers and programs, and state agencies like the Office of Victim Services, Department of Health, and the Office of Children and Family Services. Carrie Boatingheimer is a court analyst with the New York State Office of Court Administration. She's currently serving as one of the region's co-chairs for the DVRC.
I think they are so crucial to addressing system gaps, to addressing challenges and strengths. It focuses on what your community does have, what it doesn't have. It builds a level of transparency between the agencies for information sharing.
Lindsay Cruzon-Muse is another co-chair. The director of St. Peter's Health Partners Crime Victim Services, Cruzon-Muse, says they serve about 600 patients a year for DV-related injuries.
Having these discussions is critical. We talked a lot about some of the strengths that already exist within the regions, the Capital Region, and all of the counties encapsulated in that. But we also talked about some of the barriers and ways to overcome those barriers.
One notable difference in this year's DVRC is an increased number of law enforcement agencies taking part. Michael Whiteley is OPDV's new Director of Law Enforcement Training. A retired sergeant himself, Whiteley says keeping first responders informed about best practices and resources available to survivors is a must in the fight to combat DV.
We're here about the victims. We're here to help. So I think what we're hearing is that they want to be involved in this. I think they may have been shut out a little bit, with events that have occurred over the years, but I'm ready to bring them back in, and they want to be in these conversations and part of the responses.
The coordinated community response discussion is getting such positive feedback. The plan is to keep the conversation going at the second round of DVRCs later this year.
And so far, everyone has left very energized. People are coming up wanting to go to the next level of coordinated community response, and there's a lot of really dedicated people across the state who really want to help survivors.